Colon cancer is one of the fastest growing health concerns today, not only among older adults but alarmingly among younger populations as well. This upward trend has sparked urgent discussions about the causes, symptoms, and preventive measures for this deadly disease. Why is colon cancer on the rise, and what can you do to protect yourself? Understanding the warning signs and making lifestyle changes could save your life, or the life of someone you love. Stick around to learn about the critical symptoms, risk factors, and proactive steps to safeguard your health. Colon cancer ranks as the third most commonly diagnosed cancer and the second leading cause of cancer deaths worldwide. Its increasing prevalence in younger populations, those under 50, is particularly concerning. Once considered a disease primarily affecting older adults, the trend has shifted, suggesting that a combination of genetics, environmental changes, and lifestyle factors may be contributing to this alarming rise. While family history accounts for about 5 to 10% of cases, research shows that diet, physical activity, and other lifestyle choices play a far larger role in the development of colon cancer. Poor dietary habits, a sedentary lifestyle, and the consumption of ultra-processed foods have been linked to the disease's progression, while a balanced diet rich in antioxidants and anti-inflammatory compounds may offer protection. Colon cancer begins as small, non-cancerous growths called polyps that form in the lining of the colon or rectum. These polyps are often asymptomatic and may remain undetected for years. Over time, some of these polyps can turn cancerous, highlighting the importance of early detection through screenings like colonoscopies. Early diagnosis can prevent these polyps from becoming malignant and significantly improve survival rates. Recognizing the warning signs of colon cancer is critical for early detection and effective treatment. Here are the key symptoms to watch out for. One of the earliest signs of colon cancer is a noticeable and persistent change in bowel habits. This can include constipation, difficulty having bowel movements for several days or even weeks, diarrhea, frequent loose stools without an obvious cause, alternating patterns, switching between diarrhea and constipation, narrow stools, feces becoming pencil thin, indicating a narrowing of the intestinal passage caused by a tumor. If you notice any unusual changes in your bowel habits lasting more than a few weeks, consult a healthcare professional immediately. Blood in the stool is a major red flag for colon cancer. It can appear as bright red streaks, often linked to bleeding in the lower colon or rectum. Dark tar-like stool known as melena, this suggests bleeding higher in the digestive tract. While other conditions like hemorrhoids or anal fissures can also cause bleeding, it's essential to rule out colon cancer through medical evaluation. Unexplained abdominal pain, cramps, or discomfort can indicate colon cancer, especially if it's accompanied by bloating or gas. Tumors may block the passage of stool, leading to pain from built-up gas in stool, colicky sensations that come and go. Persistent or severe abdominal pain should never be ignored. Unexplained weight loss. Losing weight without changes to your diet or exercise routine is a potential warning sign of colon cancer. Tumors can reduce nutrient absorption, interfering with your body's ability to digest food properly. They can also suppress appetite by releasing inflammatory chemicals and increase energy use, causing the body to burn more calories than usual. A sudden, significant weight loss should prompt a visit to your doctor. Fatigue and weakness. Cancer cells consume a large amount of energy, leaving the body drained. Fatigue can also result from chronic blood loss, leading to iron deficiency anemia, and toxin buildup due to the body's inability to remove waste effectively. If you're constantly tired despite adequate sleep and rest, it's worth investigating. Feeling of incomplete evacuation. Even after a bowel movement, you may feel like there's something left behind. This sensation, known as tenesmus, is often caused by a tumor in the rectum or lower colon. It can lead to a persistent urge to defecate and thin, ribbon-like stools as feces pass through a narrowed section of the intestine. Dark or pale skin anemia. Chronic bleeding from a colon tumor can lead to iron deficiency anemia, resulting in symptoms like pale skin, weakness, and dizziness. If you suspect anemia without an obvious cause, consult your doctor for further tests. Why colon cancer is rising among younger people. The increase in colon cancer rates among younger adults is tied to modern lifestyle factors, including dietary changes such as high consumption of ultra-processed foods, sugary drinks, and red meat. Obesity, as excess body weight promotes inflammation, a known risk factor for cancer, and sedentary lifestyles, since reduced physical activity correlates with increased cancer risk. These trends have prompted medical organizations to lower the recommended screening age for colonoscopies from 50 to 45 for average-risk individuals. Preventing colon cancer. Fortunately, there are several steps you can take to reduce your risk. Eat a high-fiber diet. Incorporate fiber-rich foods like whole grains, fresh fruits and vegetables, legumes, and nuts. Fiber helps promote healthy digestion, prevent constipation, and maintain a balanced gut microbiome. Limit red and processed meat. Reduce consumption of sausages, bacon, and salami, as well as red meat. These foods contain preservatives and compounds that increase cancer risk. Stay hydrated. Drink at least 6 to 8 glasses of water daily to prevent constipation and support smooth digestion. Exercise regularly. Physical activity helps regulate hormones, reduce inflammation, and maintain a healthy weight. Aim for at least 30 minutes of moderate exercise 5 times a week. Avoid smoking and excessive alcohol. Both tobacco and alcohol are linked to colon cancer and other forms of cancer. Incorporate anti-inflammatory foods. Include foods like turmeric and ginger, omega-3 rich fish such as salmon, green tea, and dark leafy greens. These foods combat chronic inflammation and oxidative stress. Get regular screenings. Regular colonoscopies can detect and remove polyps before they become cancerous. Discuss with your doctor when to start screening, especially if you have a family history of colon cancer. What to expect during a colonoscopy. A colonoscopy is a crucial tool for detecting colon cancer. Here's what happens. Preparation. You'll take a laxative the day before to clear your bowel. Procedure. A thin, flexible tube with a camera is inserted into the colon under sedation. Polyp removal. Any polyps are removed and tested for cancer. The procedure is painless and usually lasts 30 to 60 minutes. Know the symptoms. Be vigilant about changes in your body. Watch for signs like changes in bowel habits, blood in the stool, unexplained weight loss, fatigue, or persistent abdominal discomfort. These could be early indicators of colon cancer. Be proactive. Prevention starts with healthy habits. Eat a balanced diet. Incorporate plenty of fiber-rich foods, fruits, and vegetables while reducing your intake of processed meats and sugary foods. Exercise regularly. Aim for at least 30 minutes of physical activity most days of the week to improve overall health and reduce cancer risk. Stay hydrated. Drink enough water to maintain proper digestion and bowel function. Get screened. If you're 45 or older or younger with a family history of colon cancer, talk to your doctor about scheduling a colonoscopy. Spread awareness. Share this information with your loved ones. Educating others about the importance of recognizing symptoms and getting regular screenings can save lives. Colon cancer doesn't discriminate. It can affect anyone, but early action makes all the difference. Take charge of your health. Your health is your most valuable asset. By taking steps today to prioritize screenings, adopt healthier habits, and pay attention to your body's signals, you're building a foundation for a longer, healthier life. Stay informed. Stay proactive. Stay healthy.